Hello everyone, welcome back to my channel. Today our topic is antifungal drugs. Let's see what are the fungus. Infectious diseases caused by fungi are called mycosis and they are often chronic in nature. Unlike the bacteria, fungi are eukaryotics with rigid cell walls composed largely of chitin rather than peptidoglycan in bacteria. As well as in addition, fungi cell membrane contain ergosterol rather than the cholesterol. Let's move on to the antifungal drugs. Antifungal drugs can be classified into two different categories. First one is the drugs that used for subcutaneous and systemic mycosis. Second one is the drugs for cutaneous mycosis only. Amphotericin B, fluconazole, and itraconazole will be used for subcutaneous and systemic mycosis, where clotrimazole, griseofulvin, miconazole, and nystatins are drugs for cutaneous mycosis. Let's elaborate drugs for subcutaneous and systemic mycosis. First drug is amphotericin B. This drug is produced by Streptomyces nodosus. Mechanism of action of this drug is since amphotericin B bind to ergosterol in the plasma membrane of sensitive fungal cells. Ergosterol is going to bind to the plasma membrane ergosterol of this fungal cell and it forms pores like channels and that require hydrophobic interaction between the lipophilic segment of the polyene antifungal and the sterol. The pores disturb membrane function, allowing electrolytes such as potassium and small molecules to leak from the cell of the fungal cell. This results in the fungal cell death because potassium and other uh, small molecules will go away from the fungal cell and it will not uh, survive in that environment and this cell death will occur. Antifungal spectrum of amphotericin B is it is fungicidal as well as fungistatic. It is mostly effective against Candida albicans and Histoplasmodium capsulatum. Pharmacokinetics of amphotericin B is it's mostly used for systemic infections and it obviously gives by IV and it slightly low concentration can be found in blood-brain barrier in CSF as well. It does cross the placenta. It also has mainly a low therapeutic index. So the dose of the amphotericin B should maintain carefully. Adverse effect of amphotericin B are fever and chills, renal impairment, and hypertension. Azoles, two azoles are there, imidazoles and triazole. Actually, imidazoles are drugs that used for cutaneous infection only. Triazoles are the drugs that used for subcutaneous and systemic mycosis. Triazoles examples are fluconazole and itraconazole. Mechanism of action of triazoles are it inhibits ergosterol biosynthesis by disrupting the membrane structure and function. Same as when the membrane structure and function is disturbed, fungi can be static. In here, it will be static, not fungicide. Actually, itraconazole has broad antifungal spectrum compared to the fluconazole, but adverse effects are there. Those can be teratogenic and obviously should avoid in pregnancy and of course, before getting pregnancy as well. If you are planning to get pregnant, you should not use fluconazole, itraconazole drugs. Let's move on to the drugs for cutaneous mycosis. First category is squalene epoxide inhibitors. Drug in this category is terbinafine, which is used for dermatophyte onychomycosis. Mechanism of action of squalene epoxidase inhibitors are actually those agents act by inhibiting squalene epoxidase. Ultimately, it's blocking the biosynthesis of progesterone, which is an essential component of the cell membrane of fungi. This accumulation of toxic amount of squalene results in increased membrane permeability and death of fungi cells. Fungi cells will be killed by increasing the membrane permeability. Adverse effects of these drugs is it causes GI disturbances and rarely can cause taste and visual disturbance as well, and cause problems to hepatic transaminase as well. Second drugs in this category is crucifolin. It is used nowadays. It is used for dermatophytosis of scalp and hair only. It is act as a inhibit fungal mitosis and not fungicidal but fungistatic. Imidazole category drugs that widely used is clotrimazole, ketoconazole, and miconazole. Actually, ketoconazole is nowadays not in use because of the hepatic impairment problems and all. But clotrimazole and miconazole are widely used as topical drugs that's used for tinea infections and contact dermatitis as well. That's all about antifungal drugs. Thank you.